Good morning, everyone. My name is Álvaro Breton, and today I'm going to be talking about the Unit 3 Professional English in Use. Today we're going to be talking about chapters 14 and 14, 15, 16 until 23. The first one, 14, the exercises. 14.1, complete the table with words from C opposite. Put a stress mark in front of the stressed syllable in each word. The first one has been done for you. We have a noun and adjective. The first, we have a noun, exhaustion. The adjective will be exhausted. Fatigue, lethargy will be lethargic, and tiredness will be tired. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Complain of were one of the words that I made. Also, we have off color, out of sorts, present with, put on, and worn out. Now, complete the sentences with the correct form of the verb present. A 67-year-old man presented with a 9-month history of increasing soreness of breath. The most common presentation is loss of consciousness. Cranial arthritis may present as fever without any obvious causes. The patient usually presents with a severe sore throat. The presenting symptom in this patient could perhaps be due to renal failure. Other conditions with a similar presentation include acute cholecystitis. Reduced growth is an important presenting complaint of celiac disease. 2 months following presentation, the patient was able to walk. Now, read the patient's description of her symptoms, then complete the case report. Look at C opposite to help you. I was well until a few months ago. In the beginning, I just felt off color and a bit tired, but lately I've been feeling completely worn out at the end of the day. I'm not eating any more than usual, but I've put on 9 kilos in the last year. My emotions are hard and my hair has started to fall out. The case. A 50-year-old housewife who had been well until 4 months previously complained of tiredness and lethargy. She had put on 9 kilos in weight in the year before she presented to her GP. Although she denied eating more than usual, she was off color and she noticed that hair had started to fall out. Now, exercises of chapter 50. Find words in the box with opposite meaning. Look at B and C opposite to help you. Adequate, inadequate. Against, for, unlikely, likely. Severe, mild, mild, severe, rare, common, common, rare, sudden, insidious, insidious, sudden, inadequate, adequate, for, against, and likely, unlikely. Now, make word combinations using a word from each box. Look at B and C opposite to help you. We have bone marrow, differential diagnosis, insidious onset, iron deficiency, pernicious amnesia, progressively increasing, and vibration sense. Now, complete the sentences. Look at A, B, and C opposite to help you. A 39-year-old man presented with a history of progressively increasing abdominal distension over a period of 6 months. Blindness may be caused by vitamin A deficiency. The bleeding and purpura are caused by abnormal platelet function. The white cell count is normal, so we can exclude acute leukemia. The yellow color of her skin and conjunctivitis is probably due to jaundice. There was a palpable mass in the right upper quadrant of the abdomen. Treatment is aimed at restoring fluid balance with adequate intravenous fluids. The anemia may be due to increased red cell destruction. Now, complete the conversation. Look at C opposite to help you. Professor, what is against the diagnosis of pernicious anemia on physical examination? Student, the problem started quite suddenly, so he didn't have the typical insidious onset. He doesn't have any skin pallor, and he doesn't have paresthesia, or absent vibration sense, and I couldn't feel his spleen. What about his tongue? Says the professor. The student says his tongue was normal and not inflamed or smooth. Now, exercise of chapter 16. Label the diagram using words from the box. Look at A opposite to help you. Breastbone is number 4, as we can see with the drawing of the skeleton. Collarbone is 6, jawbone is 2, kneecap is 9, rib is 5, shin bone is 10, shoulder blade 7, skull is 1, spine is 3, and thigh bone is 8. Now, match the type of fractures with the description. Look at B opposite to help you. Now, an open fracture is a break in the skin. Now, comminuted, in this case, the bone is broken into several pieces. Displaced, the broken pieces are pushed together. Displaced, the broken pieces are separated. Green stick, the bone is bent. It occurs mainly in children. And impacted, the broken pieces are pushed together. Complete the text with extra. Look at C opposite to help you. Reduction of a fracture involves trying to return the bones to as near to the original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will heal, but it may go to malunion. Now, exercises of chapter 17. Complete the table with words from A and C opposite to help you. Then complete the sentences with words from the table. We have verb, noun, and adjective. We have the verb delay. The noun will be delay, the adjective delayed. Now, develop, development, and developed. Distend, distension, distended. Fail, failure, and failed. Nourish, nourishment, and nourish. Babies with the fetal alcohol syndrome may present with failure to thrive. Abdominal distension may be due to enlarged liver. Small amounts of alcohol in pregnancy can affect the fetal development. Mortality from measles Mortality from measles can be reduced by better nourishment. Delay in one or more of the milestones may be the first sign of disease. Complete the sentences. Look at A and C opposite to help you. After sitting, babies learn to crawl and then to walk. A child who has started eating solid food has been weaned. Someone who is not very tall is said to be short of stature. The stages in a child development are known as the milestones. A child who is beginning to develop sexually has reached puberty. Now, write a common English name for each disease using your medical knowledge. Enlarged parotid glands, it's mumps. Difficult opening the mouth will be tetanus or locked jaw. Rash and enlarged posterior occipital nodes will be rubella. Paroxysmal cough with vomiting will be whooping cough. Papules and vesicles, first on trunk, will be chickenpox. Cough and cold followed by rash will be measles. Sore throat and rash will be scarlet fever. Swelling joints and a hard murmur will be rheumatic fever. Fever followed by muscle weakness will be polio. And cough with stridor will be croup. Now, exercises of chapter 18. Complete a table with words from A, B, and C opposite and related forms. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. We have verb and noun. The verb inhibit, the noun will be inhibition. Produce, production. Release, release. Replace, replacement. Secrete, secretion. And stimulate, stimulation. Complete the passage from a textbook using the illustration and your own knowledge. Look at B opposite to help you. Pulses of gonadotropin release hormones are released from the hypothalamus and stimulate LH and FSH are related from the pituitary. LH stimulates testosterone production from Leydig cells of the testes. Testosterone feeds hack on the hypothalamus pituitary to inhibit GnRH release. FSH stimulates on the Sertoli cells in the seminiferous tubulus to produce mature sperm, and the inhibins A and B. Inhibin cause feedback on the pituitary to decrease FSH secretion. Complete the sentences. Look at A and C opposite to help you. A generalized change affects many parts of an organ or gland. A localized change affects only one part. His diet is deficient in iron and he doesn't get enough iron. Increase T3 and T4 increase the basal metabolic rate. Match Mrs. Davis' symptoms with the question her doctor asked. Look at D opposite to help you. Diarrhea. Are your bowels normal? In the case that he asks for what is your appetite like, he's asking for if you're eating more. In heat intolerance, we have do you prefer hot weather or cold? Overactivity, we have are you able to sit and relax? Palpitations will be have you ever felt your heart beating rapidly or irregularly? Weight loss, is your weight steady? And tremor, do your hands shake? Now, exercises of chapter 19. Complete the table with words from be opposite and release forms. Verb, noun, adjective. We have accommodate, noun, accommodation, and adjective, accommodative. Constrict, constriction, constricted. Converge, convergence, convergent. Dilate, dilation, or dilatation, and the adjective is dilated. Droop, we have drooping and droopy. Oscillate, we have oscillation and oscillating. React, we have reaction and reactive. Match the pictures with the conditions. Look at the opposite to help you. The first one we have squint. Second one we have irregular pupae. The third one we have dilated pupils. In the fourth one we have constricted pupils. Then D we have cataract or cataract. A we have drooping of eyelids. Now, complete the extract from a textbook. Look at the opposite to help you. Run a tenoscopy. Examine the retina with an ophthalmoscope. If possible, with the pupils dilated to obtain the maximum view. Look at the papilledema and for flame shape. Hemorrhages and heart exudates. Assess the state of the vessels and note the presence of any narrowing as well as nipping and arteriovenous crossings. Now, exercise of chapter 20. Complete the case report. Look at A opposite to help you. Case 14. Physical examination. Reveal a thin girl with slight pallor. She was not obvious dehydrating. The temperature was 38 Celsius up with a pulse of 100 minutes. Blood pressure with 110/80. Examination of the rest of the cardiovascular and respiratory system was normal. The abdomen was not tender. There was a generalized tenderness, which was most marked in the right lower quadrant, and was associated with guarding, but not rigidity. There was no rebound tenderness, and no masses were felt. Vowel sounds were reduced. Now, match the description of the stools with the conditions most likely to cause them using your medical knowledge. Look at the opposite to help you. Now, type of stool. With loose or bloody, we have ulcerative colitis. Loose, pale, or bulky, we have colitic disease. Or clay color, we have obstructive jaundice. Black or tarry, we have gastric ulcer. Small and hard, we have irritable bowel syndrome. And lastly, we have clear, watery, and mucus, which is cholera. Now, match the features to the doctor's questions. Look at the opposite to help you. Blood. Have you passed black stools? In bowel habit, we have how often do you use your bowels? A change in bowel habit would be are you going to the toilet more often than normal? Bulk, we have is the size or the amount of the stool normal. Color, what about the appearance of the stools? Consistency, we have are the motions hard or loose? And offensiveness. We have do the motions have an unusual smell? Now, exercises from chapter 21. Write a simple English phrase for each of the medical terms below using your medical knowledge. Look at A and B opposite to help you. Hysterectomy, the removal of the uterus. Menorrhagia will be a heavy menstrual bleeding. Salpingitis will be inflammation of the fallopian tubes. And cervical biopsy will be a sample of the tissue from the cervix. Read the conversation between the gynecologist and the patient in C opposite and complete the notes about the patient. Meniarch. Age of your spirit. Menstrual cycle. Regular length. LMP. Date of last period. Menorrhagia. Yes or no, because it's a question. No heavy bleeding or yes heavy bleeding. Also a question, dysmenorrhea, dysmenorrhea, painful periods, discharge, presence or absence. Now, write the questions that the doctor asked. Look at C opposite to help you. Menarche. When did you have your first period? Menstrual cycle. Are your periods regular? LMP. When was your last menstrual period? Menorrhagia. Do you have heavy periods? Dysmenorrhea. Do you have painful periods? And discharge. Have you noticed any discharge? Now, complete the case report. One word is needed twice. Look at B and C opposite to help you. Now, case 15. A 45-year-old woman had been having heavy periods lasting from 8 days, with the passage of clots. For 9 months, there was no bleeding between periods or after intercourse. Her periods were not particularly painful. She had not noticed any hot flushes or night sweats, and her general health has always been good. She had taken the oral contraceptive pill until a year previously when a copper coil was fitted. She had a normal pregnancy when she was 25. Complete the conversation based on the case history in B opposite. Doctor, one seems to be the problem. The patient, I've been getting breathless. Doctor, how long have you had them? The patient, for about 6 months, but I have heart problems for years, with tiredness and shortness of breath. In the end, I couldn't walk on more than 100 meters without having to stop. I had to sleep on 3 pillows. I had a valve replacement 3 years ago, and that improved things for a while. Make word combinations using a word from each box. 2 words can be used twice. Look at B and C opposite to help you. At rest, atrial fibrillation, cardiac output, heart failure, on effort, heating edema, and premature beats. Now, write the words a patient will use to describe the symptoms below. Look at A, B, and C opposite to help you. Dyspnoea, shortness of breath, arrhythmia, irregular heartbeat, orthopnea, orthopnea, breathlessness when lying flat, edema, swelling. Now, exercises of chapter 23. Complete the table with words from A opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. We have verb and noun. In verb, we have auscultate, noun, auscultation. Examine, examination. Inspect, inspection. Palpate, palpation. Percuss, percussion. Put the steps for examining the heart and circulation in order, according to the 4-stage system. Look at A opposite to help you. First, we have look for clogging. Then we have feel the radial pulse, locate the apex V, measure the heart size, note any thrills, and lastly, are there any murmurs? Now, a doctor is presenting the case of a 43-year-old woman at a meeting with the cardiology department. Complete the text of her presentation. Look at B opposite to help you. On examination, she was parexial with a temperature of 38.5. If she was short of breath, her pulse was variable between 100 and 180 and was irregular in time and volume. Her blood pressure was 130 over 80, and her GVP was up to 5 centimeters, showing normal movement with respiration. Her peripheral pulses were all present. There was no clogging or central cyanosis. Her apex V was displaced to the anterior axillary line, but still in the fifth intercostal space. Her heart sounds were very interesting. When she was initially examined, it was noted that she had a pan-systolic and mid-diastolic murmurs, heard best at the apex. When she was examined, some hours later, there was a harsh pericardial friction, RA, all over the pericardium. Our diagnosis at the time was of mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation. Well, this is all for today. Thank you for hearing me talk about the exercises of Unit 3 of Professional English Use.